Many core exercises could be making your scoliosis worse. If you have scoliosis and you're doing or you're thinking about doing core stabilizing exercises, be sure to watch this video first. You see, many core stabilizing exercises could actually make your curve worse if done improperly, or if you're doing the wrong exercises for your specific spinal curve. Hi, I'm Dr. Chris Gubbels, leading authority in the non-surgical treatment of scoliosis and hyperkyphosis. And in this video, I'm gonna go over which exercises you wanna avoid if you have scoliosis and why. Now, if you have scoliosis and you have not already downloaded our free ebook on treating scoliosis, be sure to click on the link below in the description and get your free copy. You see, people are told all the time to do core stabilizing exercises to help with their scoliosis. But you have to remember what scoliosis is. Scoliosis is a three-dimensional spine deformity where the bones are actually misshaped. And the curve of the spine actually has a rotation. The spine is actually twisted or rotated, and there's lateral flexion. Additionally, when someone gets a scoliosis curve in their mid or thoracic spine, that frequently accompanies a flattening or a decrease in the normal kyphotic curve in the thoracic spine. And when you get a scoliosis in your lumbar or lower spine, that frequently is accompanied by a lack or a decrease of curve in the lumbar spine. And because of this, some exercises could make the curves worse. For example, if you're doing rotation in your exercise and that's putting additional rotation into the curve, that could cause the curve to worsen. Also, if you're doing an exercise that puts additional flattening in the thoracic or lumbar spine, you could potentially decreasing the curves from the side in your mid back or low back, which can also cause the spinal curve to increase and potentially increasing pain. Because of that, you have to know what you're doing. You see, I have a lot of patients that come to me who have watched videos online, or they've gotten some suggestions or advice from another healthcare provider on what they should do for their scoliosis. And a lot of times the things they're recommended are actually inaccurate or inappropriate. Many times they can actually make the curves worse. I see this all the time. I can think of a patient that came in last week and she had been seeing a scoliosis therapist in California before she moved to Colorado. And we started going through her scoliosis rehab. She had all these questions on things that she had been taught by other providers. So I had her start going through everything that she had been shown or told to do. And about half of the exercises she was actually recommended by another healthcare provider were actually making her curves worse. You see, this patient had two curves. She had one curve in her thoracic spine and one curve in her lower spine. And although she was doing some things that could potentially help her upper spine, when she was doing those, she was actually causing damage and potentially harming her second curve in her lower spine. So you have to know what you're doing. So in this video, I'm gonna go over some things you should definitely not do. And I always recommend that you go see a professional, someone that specializes in the non-surgical treatment of scoliosis first before you do any kind of home treatment or any kind of active treatment for your scoliosis. But without further ado, let's dive into 5 core stabilizing exercises you want to avoid or potentially avoid if you have scoliosis. Now, the first exercise we recommend avoiding is probably the most common core stabilizing exercise out there, which is a traditional abdominal crunch or sit-up. You see, when you do a traditional crunch, you're flexing your upper spine, your thoracic spine, but you're also flexing your lumbar spine. This causes a loss of the normal lordotic curve in the lumbar spine. And a decrease in the lumbar curve can accelerate or sometimes even potentially being a cause of scoliosis. In adults that have a degenerative scoliosis, one thing that could be contributing or actually causing that scoliosis is a loss of the lumbar spine from the side. And a loss of the lumbar curve from the side is one of the biggest predictors of chronic pain and disability in the lower back. So if you have scoliosis, degenerative scoliosis, a curve, if you have scoliosis in your lower spine, your lower back, you will want to avoid doing crunch exercises. The second exercise you want to avoid if you have scoliosis is a Russian twist. Like I said before, scoliosis is a rotational deformity. And when you do a Russian twist, you're basically twisting and rotating the spine repetitively. And although one direction could be making your curve in a lower back better, going in the opposite way would be making it worse. Also, if you have more than one curve in your spine, what makes one curve better would make the other curve worse. For this reason, we recommend avoiding core stabilizing exercises like the Russian twist if you have scoliosis. The third exercise you want to avoid if you have scoliosis is Supermans. You see, Supermans is an exercise where you're laying down on your stomach in the prone position and you extend your arms and your legs. But when you do this, you flatten the curve in the thoracic spine. And as I mentioned, when you get a scoliosis in the thoracic spine, that's frequently accompanied by a decrease in the normal kyphotic or normal curve in the thoracic spine when viewed from the side. Sometimes you can even have a reversal of that normal thoracic curve if scoliosis is severe enough. So when you have scoliosis, especially if you have scoliosis in your upper body or your thoracic spine, you want to avoid exercises that put additional thoracic extension into your body. For that reason, if you have scoliosis, especially if you have scoliosis in the thoracic spine, you want to avoid doing Superman or thoracic extension exercises. The fourth exercise you want to avoid if you have scoliosis is any kind of rotation with resistance. These are done a lot of times by people because they think they could potentially be helping their scoliosis. But the reality is they're very unspecific. When you do scoliosis exercises that are designed to correct or help stop a curve from progressing, they have to be very precise and very specific. And if you're doing a rotation like this, although it may potentially be helping one curve, it could be making another curve in your body worse. So for this reason, we recommend avoiding doing any kind of rotational twist with resistance. And the last exercise I'm going to go over that you want to avoid is a side crunch. You see, a side crunch actually involves a lateral bending and twisting of your spine. You may not think there's twisting involved, but the normal coupled motion or the normal motion of your vertebrae are in your low back. When you laterally bend, the vertebrae actually twist and rotate. So in this example, the person's doing a lateral bending motion with a weight. So if you have scoliosis, we recommend avoid doing any kind of crunches or side bending or laterally flexing, whether you're standing or you're lying down. Now, if you have scoliosis and you're watching this, you're probably trying to figure out what things you should do. First of all, when it comes to scoliosis, the most effective exercises to decrease pain, stop or potentially slow progression, and potentially reducing the size of the curve are scoliosis specific exercises like ScoliBalance or Schroth or something like that. General core exercises are not as effective in decreasing pain or slowing the curve progression, and they definitely can't reduce the size of the curve. So if you're wondering what's going on with your curve and if scoliosis specific exercises may be a good treatment or what other treatment options would be good for you, click on the link below and request a free discovery call. That will give you a chance to talk to me for me to review your x-rays in your spine, tell you more about your scoliosis, the risk of progression, and most importantly, what treatment options you may be a candidate for. Now, if you're watching this, you're probably wondering, okay, these are some things that I shouldn't do, but what kind of exercises or things can I do for my spine? So to learn more about what core stabilizing exercises can be good for your spine if you have scoliosis, click on our next video where I demonstrate core stabilizing exercises for people with scoliosis.